بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الله الأمين. Thank you everyone who are here in place and who are online with us everywhere. And thanks to you all for giving me a chance to speak with you about One Health capacity building in Somalia and the way forward to support Somali community and policymakers. That is very important so as to promote One Health workforce in Somalia and to generate our own new generation practitioners. Next. Yes, education. Which way? Before injecting education with One Health concept, education is or was only produce knowledgeable discipline. General capacity building already produced skilled disciplinary workforce. However, One Health capacity building is the source of One Health concept competence, multidisciplinary workforce. Very important to include the community and the policymakers. And that is the One Health workforce needed for adopting, for implementing, for One Health approach. We can agree, all of us, if not most of us, of course, that Somalia doesn't lack any kind of livelihood resources. Human resources, allow me to say, mashallah, alhamdulillah, alhamdulillah. Livestock resources ranking first in one of the most important animal on the earth. Agricultural products, which kind of food we don't produce from the land of Somalia. Marine resources, maybe they can compete with South Africa. Unfortunately, the community repeatedly faces severe, consistent, sometimes repeated challenges. I'm not going to mention them all, but only one example I experienced 10 years ago while I'm here in Somalia. In some part of Somalia, the year is 12 months. 6 months is the same part of the country suffer from floods, and the other 6 months is the same area suffer from drought. That is, I don't call it as environmental degradation. It is very possible to be solved by One Health capacity building, and even to make a very big, very positive change for all challenges that suffer by Somali community. So One Health capacity building is now adopted by education institutions. Fortunately, Abdalla University through One Health Center is one of these international institutions. There are many capacity activities for One Health capacity building, including socio-economic evaluation of policies and programs. I'm not considering always community and One Health and policymakers as stakeholders. No, community and policymakers are equal partners in capacitating One Health workforce. So there is some effort of One Health capacity building in Somalia, but it is scattered and limited and uncoordinated. And this may contribute to persistence of health and livelihood challenges in the country. Yes. I fully agree with Dr. Marie yesterday. I am One Health maybe student there. One Health is very old. One Health capacity building itself is very old. Just now after initiation of One Health concept, so people start to understand that it is important for everyone. 15 centuries ago, Nabi sallallahu alayhi wa sallam asked as a scientist, decision maker, as a community, to never defecate or never urinate in water, in the street, and under the trees. Allow me to quote in Arabic, اجتنبوا الملاعن الثلاث الماء الطريق الظل. This is one health capacity building from a decision maker to his community, including us. 15 centuries ago, Nabi sallallahu alayhi wasallam stated that you may stop something or anything or everything during life, but never stop cultivating a tree up to the end of the life. This is one health capacity building from decision maker, a scientist decision maker, to the community. Then, even me while I am in Duxi, I am in school, always we like to see mobile cinema. Even though they are educating us just about infectious diseases and zoonotic diseases, transmission and control, but this is very historical, very old. After that, or during that already, development in academia, development of environmental studies and public health, if at that time, always if at that time we initiate One Health at that time will be very, very effective, because now the problem is that even environmental studies colleges and public health start working disciplinary, and sometimes they can fight each other to get together with health people. So, looking at the diagram of One Health vision, you can see mostly it depends on One Health capacity building, targeting the community culture to sustain the good traits and to change the bad ones, and targeting the education community, including professions, then targeting decision makers in their political will, and financial support and coordination efforts between ministries and between disciplines and between different sectors. When we say financial support, sometimes policymakers they become afraid, but One Health capacity, One Health approach is very different. It can add value, it can generate more saving for the government from global up to project levels. Even the results were very efficiently with very low cost in compared with distributing financial to different ministries or to different sectors or to different institutions. Yes. If I want to select one word for the characteristic of One Health capacity building, just look at smiling, happy, cleaner and cooker, herder and farmer there. They are very happy, not because their salary is equal to those professional physicians or researchers or diplomats. No, just because they are happy because they find that people start to understand and to appreciate their contribution on that. So this is why for me, in one word, the characteristic of One Health capacity building is equality. Activities to conduct for One Health capacity building include multidisciplinary training programs to develop One Health workforce without disciplinary barriers. Because now in One Health we are not talking about interdisciplinary, we are talking about transdisciplinary. Postgraduate education, educating communities, and reviewing curricula. This is very important. If we review the curricula, yes, we need the students to understand and appreciate the contribution of disciplines outside their own. This will be very good One Health capacity if we start working with curricula always. Because if everybody understand that everyone is similar, equal in contribution to health, that will be, even with it will make engaging of national and subnational governments integration of One Health into national policy planning and legal mandates more easier if we start from education. In this presentation, of this paper, we reviewed the most important networks, platforms, and platforms working on One Health capacity building in East Africa, and the position of Somalia was in these institutions was discussed. Then we reviewed One Health capacity building in Somalia, the effort of One Health capacity building in Somalia, and the case of Abrar in this concern was discussed. Then the way forward to capacitate and to engage the community and the policymakers was concluded. Yes, we mentioned this already, I think. Okay. So these are the challenges in Somalia, and One Health capacity building, as I said, can solve these conditions. When we work together, we can achieve more than when we can achieve when everyone works alone. If you can see, for example, the standard development goals, the most who are affecting Somalia here, if we use education and One Health capacity building, we can make the positive change for Somalia. For war, I don't mean the war between countries or between armies or between parties. I mean the war between individual offices, ministries, individual households. Also it affects the life of human, animal and environment so severely. Also, we have to remember that Nabi sallallahu alaihi wasallam stated that for the soldiers during war, not to cut trees, together with not to kill children, women and old men, also not to cut the trees. These pictures are not from the war in Somalia. These pictures are from the ongoing war in Sudan. Why are those people, they can cut the neck of one of the most important animals on the earth? So you can imagine what they can do for human and the environment. Somalia is a part of, or was a part of Horn, and Somalia is a part of One Health for Heal, but unfortunately Somalia is not a part of the most important platforms working in One Health capacity building in East Africa. COHESA, up to December 2023, Somalia was not part, although they promised at the same meeting there that they will include Somalia. AfroHorn, they were here in One Health, in the first Somali One Health conference, and also they promised to include Somalia in conditional if they find extra fund, for example, or more funds. So really we lost a lot in the regional One Health capacity building in platforms that are well funded. So if we move to the effort of One Health capacity building in Somalia, taking Abrar case as a case here in this presentation, yes, 10 years of efforts in One Health in Abrar University. Internally, Abrar University published many papers on zoonotic diseases and pure One Health scientific papers. Their regional, continental and global collaboration equipped the university with 6 experts in One Health and several collaborative One Health research grant proposals. Their regional, continental and global participation in different One Health activities, internationally or globally, this results in that Abrar University is a unique Somali One Health figure for the international One Health partners. Abrar University already established Somali One Health Center, and they are working now in reviewing the undergraduate and the postgraduate curriculum. For the decision makers, Abra University sent messages to the top Somali decision makers and implemented meetings, presentation on One Health at ministerial levels. Abra University always invite leaders to specialized webinars. We appreciate in Abra University the presence of those leaders and decision makers in our all One Health activities, including the first Somali One Health conference, and this conference as partners in One Health workforce in Somalia, not only as honorable guests. We always in our university already proposed and participate effectively in the establishment of One Health University network in Somalia. And this is very, very good moving when Abrar already designed or developed a curriculum, 6 months curriculum for One Health certificate. And this will make very big, very positive change for the community and the policymakers, and even for the strategy of One Health in Somalia. Abra University for community, Somali communities, they enrich the library with research publications on One Health, capacitating the community, not only increasing their awareness. Abra University One Health researchers, students almost visit all the federal states of Somalia and talk to their community about One Health concept. Somali One Health Center monthly One Health and zoonosis webinars is very helpful for capacitating the community. Public One Health annual days ceremonies never missed at Abra University. The One Health certificate curriculum can avail trained officers for every state, region, and districts of Somalia. The way forward, maybe we can discuss, even if no time now during coffee break, for example, if this is not the first step we need to take in Somalia. We have to conduct a national short course. Let me say, even if you have a very short course on principles of One Health for policymakers, health and their allied, and collaborating professions. And institutionalizing One Health in each state, region, and districts. Establishment of Somali One Health Reference Laboratory. Yesterday, I was talking about laboratories found in hospitals. That is already each hospital have. But we need reference One Health lab in Somalia, different from to talk about hospitals or other ministries or disciplines. Distribution of investment and development projects in rural areas outside Mogadishu, in other words. Coordinated research. Now every university have research on One Health, talking about One Health, but the word coordinated here is very important, because One Health information should be under coordination. That is the One Health data we need. Coordinated research availing convincing data for policymakers to be transformed as regulations and legal mandates, injecting all education curricula with at least 1 hour of One Health concept. Researchers, trainers and trainees and students, field tours, I mean outside Mogadishu. Sustainability of ending projects, for example, One Health for Heal. Because when we prepare this paper already, even now maybe they renewed, but if these kind of projects are very important for Somali community, even working in every way, even if it is South Somalia, but to sustain these decision makers is very important. Message release to public media, including theater mobile cinema, song and paints, and website with One Health coordinated data. One Health coordinated data, not scattered in websites and media. Encourage people to meet physicians in Somalia. Yes, do that. Do that. You can do that. Yes, you can. Even if the problem is only the cost. So by capacitating decision makers, professionals, physicians, and One Health expert, it will be solved, at least to control antimicrobial resistance and other health challenges. So, in conclusion, if we don't want One Health to be like people sometimes think it's new science or new discipline. It's just different in working together. And the value of One Health capacity building will be realized when it is translated to health policy, planning, and implementation of development projects, then disease prevention and control programs. The effort of Abrar University is a possible green light for efficient in initiating, capacitating, institutionalizing, networking, and operating One Health in Somalia. Coordinated research on disease burden in Somalia is very essential for decision makers who seek to use their limited resources to the best possible effect by identifying priority development and health programs. Thank you. Mahad Sanidin. Shukran jazeelan.